Hi everyone, my name is Talana. Welcome back to ChronicallyMeT. Today I want to talk about my injection and how I get my Entyvio. Sorry for the noise in the background, there's some people doing some yard work, and if you hear dog bark, I'm also dog sitting. This is the fantastic time of year for allergies. I'm very congested and it's hard to breathe. Comment below if you have allergies and how you manage your allergies, because this really sucks. I find that the summer season has pushed everything back because this year, we got summer late, it's already July and there's still pollen on the water. So yeah, I take Entyvio. I started Entyvio in 2016, and when I started Entyvio, they put me on the IV form. And Entyvio is the type of thing that does require some startup medication boosters. It requires initial starting. So you'll take certain doses so far apart before you get onto your regular dosing cycle. So quite often Entyvio is done every 4 weeks to every 8 weeks. So I wasn't actually able to stay on Entyvio for very long at the 8-week point. We started taking it every 6 weeks, and even then that was still a little too long, so we kept it at every 4 weeks, and that's what seems to be managing my disease the best. Although, as you know, I do have an ostomy, so it didn't fix me completely. I still required the surgery, but it's what's keeping my disease at bay. So my Crohn's goes from my mouth to my bum. So even though I don't have the bum part, the bottom half, I can still get it anywhere else in my digestive tract. As well, it's an autoimmune disease, so my autoimmune system can inflame at any time. So this is what helps manage it. I'm still at risk for flares. I still have things that come once in a while. This is just, manage is the best way that I can describe how this medication works. So I would take 300 milligrams by IV intravenous for those of you that are not familiar, and I would get that every 4 weeks. So for me, what that looked like is the process of driving from my home, going to a clinic so far away, and sometimes it's usually 45 minutes or 30 minutes depending on which clinic I go to. I'd have to sit there. The infusion itself is 30 minutes at the fastest speed. So I'm not there for any shorter than 30 minutes. But I am a very hard IV start. So it usually takes 4, 5 pokes at a time if I'm really lucky. And even if the nurse is lucky, she can get it in 1 or 2 pokes. Or they can get it in 1 or 2 pokes. It's not that easy. I don't drink a lot of water. I try my best. And even on days when I drink a lot of water and I'm really good at drinking, it's still hard to get an IV. I've always been a hard start. So quite often it would take 30, 45 minutes to get an IV. Then they got to mix the meds, then they start the meds. So even though the medication only takes 30 minutes to get into you, I'm still there for an hour, hour and a half, depending on the time and my drive time. So it usually takes 2 to 3 hours out of my day at the longest. And it's such an inconvenient thing to do once a month. I really love to travel and I want to travel places, but because my medication is not readily available, I need to have someone who can infuse it to me or pay the medication to bring it with me and have someone do that, or come home for it. So I'm restricted to traveling once a month. But there's a new medication format that has come out recently, and it's Entyvio in a syringe. So I have opted for the syringe. It's a little challenging where I live in Canada. Coverage-wise, getting it paid for, that's a whole other story. If you live in Canada and you want to hear that story, please comment below so I know how many people are interested and I can share my story about how to get the syringe, insurance, coverage, and all that with my experience. But I got it. I got the syringe. I got the training for it. Here's a look at it. It's called Entyvio. This is the syringe. You'll notice the dosage is lower. It's 108 milligrams. So I take this every 2 weeks. I do the injection myself. It is super easy. I opted for the pre-filled syringe type because I don't like pens. I had Humira, I had the pen. It bruised me so much. I don't like them. I prefer these. So I'm gonna show you how I do this and stay tuned. Okay, so a couple things you want to have on hand. So the program I'm working with provided this with me. I don't actually use all of these things, but these are great for those of you who are wanting to be fully prepared. So So a sharps container, when you're done with the syringe, this is what you're going to keep it in. If you don't have one, your pharmacy can provide it for you. I think some pharmacies may charge for it, but this is very helpful and you'll need it. I use it for my B12 injections as well. Obviously you want the medication. My medication, I get 2 in a pack. This is just 1 box. I've got the other box in the fridge. So these do come refrigerated. You need to keep them refrigerated and take them about 30 minutes before you take your shot out of the fridge so they can warm up. I'll show you what it looks like in a second. I also prepare some wipes. I only use 1, but I bring a second one just in case one's a dud. I need a little extra if it's really dirty or anything. I prepare 2. I've got a ton of these around the house, so it's not like I only have 2, but I'm usually only using 1, but I've got 2. These are extra things I don't use, but you can use them if you'd like. This is a little gauze pad. If you've got a little bit of blood after the fact, or you just want to dry off after you poked yourself, it's really good. And then a band-aid if you are bleeding or you just want to cover up the hole. You can use a band-aid, that's fine. I don't really need it. I find I don't bleed afterwards, but it's personal preference. So this is what I use. Okay, so we'll go through this together. I'll show you guys how I open it. This one has a nifty tear here. So we'll just lift it up and open it up. So this is what comes in it. There are a couple leaflets. These are really good to read if it's your first time. Just to read through it. They have step-by-step instructions and I will show you how to do it. So this one is a leaflet for the actual medication itself. So it has information on it. Again, if it's your first time, it's useful to read through these at least once, but it comes every time. So I've already read that. I don't need it. I can dispose of it. The patient information. So this one is how to use the single-use pre-filled syringe. So I do want to show you what this one looks like because the images are very, very helpful. So these are great for people. Often they'll train you on how to use these, but like for those of you who've never seen a syringe before, it shows you what to look for before you use. This is the purple plunger, the finger grip, the needle guard, where the medicine is, the spring, the needle cap. You're like, what the heck is this? Like, it tells you what it is. So if you'll open this up, it says take the medication out 30 minutes before, get your supplies ready, wash your hands, prepare the syringe, and how to pick a site, how to clean your site, how to poke, dispose of it. It's like step by step. This one comes in French and English. Like, so great. It's very helpful for those of you who don't have someone to show you, and if this is all you've got, really, that's all you need. So that's that. Again, I've already read through this, so I don't need to read through it again. Now, when I get my medication, I always check that this label matches the outside of the box. And my box actually came in another box with my prescription, so I make sure they look the same and I'm not getting a different dose. So these did match my prescription on the box, and that's the same. Now what I do is I'm going to note the expiration date because I don't want to take something that expired. So the expiration date on this is August 2022. I'm in July, I'm fine right now. And the lot number's here. If there's any issue with this syringe, I can refer to this lot number. Now, I've already washed my hands. At this point, you would want to go wash your hands and make sure that your hands are very clean. So you're going to open up the medication here. And now this is what the syringe looks like. So again, you have the plunger, this is the finger grip, the pen, the spring, and the needle itself. So there's a couple things I'm going to do with this syringe before I take it. I'm going to look at the medication on the inside, if you can focus. I'm going to check that it's clear. So you can see the whole thing is clear. There's no cloudiness, no discoloration. Another thing I'm going to check is the expiration date. I'm going to make sure it's not expired. This is also the lot number if it didn't match what was on the sheet, but it doesn't matter unless you have an issue. So everything looks good. And it's not expired. I'm also going to just check for any damage to make sure that there's no faulty or damage to the syringe here. So what I do is I set this aside and I prepare my site. Now again, my hands are clean and so I don't need to wash my hands. But if you want, another step is to sanitize your hands. So I've got my alcohol swab, and what I'm going to do is I'm going to prepare my site. So you want to rotate sites. You can do in your stomach, your thighs, or the back of your arms. This is where I go because this is what my doctor in training have told me, but you can go anywhere that you've been trained or taught to go. So I want to go in fatty tissue. So I've got lots here, and I've got some here, but they're harder to use. I also have some at the back of my arms. I want to also rotate my sites. So quite often you'll do one of the 4 quadrants and just keep going in a circle. So I did my last dose down at the bottom of my bag underneath my belly here, and I'm going to do it on the top left at this time. So you'll open up your swab, and I'm going to kind of grab the area I'm poking and clean in a circular motion. The reason is I've cleaned the middle, and then I'm going to clean out from the outside. You don't want to get something dirty back on the middle spot that you've already cleaned. So middle to the outside. I was taught this in nursing school when I went for a couple years. Now you want to actually let the site dry. It's best not to fan the area because you might get some debris or dust. Anything that's in the air might come towards your site. So you want to just let it air dry, and it's really good to let this completely dry as much as possible so that when you poke yourself with the needle, you're not actually getting the alcohol in your site. That's quite often what stings the most. So I'm keeping my hand here because I don't want to lose where I've cleaned. I did kind of clean around my scar, so I kind of know where I cleaned. But now I'm going to grab the syringe that we showed earlier. So I know I can let go now because I know where I cleaned. It's kind of around the scar. So I want to take off this top cap, pull it off, and I've got the needle exposed. Now if you don't want to see this, I will be poking my stomach, so you can just fast forward a bit here. Okay, so you can grab the skin, and you want to poke fast because you don't want it to stop at your skin. You want it to go in your skin. So you want to just go 1, 2, 3, poke, and it's in my skin. Now you can push at your own speed. You can go slow, you can go fast, you can go however you want. And then you're done. When you push all the way down to the end, this is nice because it actually clicks in and sucks the needle back up, so you don't have to worry about having the needle stuck in you. Now I will take this and put it into my sharps container. You don't want it lying around. So you can see I don't actually have anything coming out, but if you want, this is where you put the band-aid on or the gauze. So yeah, it's pretty easy. It's just like that. I do that every 2 weeks. I set a calendar reminder in my phone because it's very important I don't miss a dose. Otherwise it's gonna mess up my whole schedule. So that's how I take my medication now. It's so much easier. I can take this with me when I travel. I can travel for long times as long as I have a fridge and a way to keep it cool. I can also rotate my injection by myself. So rather than calling a company and rescheduling an appointment, I can just rotate it to a day that works best for me and change it one day at a time. Obviously, this is all with discretion and conversations with your doctors and your nurses that works best for you. So if you have any other questions about medications or injections or how I do things, just let me know in the comments below. Thank you so much for watching. It really helps me out if you like this video and send your comments, and I'd love to support you. You can also follow me on Instagram at ChronicallyMeT, on TikTok at ChronicallyMeT. And yeah, so be sure to like, comment, and subscribe, and I'll see you guys next time. Bye!